Hi and Assalamualaikum everyone. So I will talk about childhood apraxia in speech or CAS. And the case that I want to share is about a young girl from Finland whom I will call as SS in order to safeguard her privacy. So SS has been navigating the challenges of a condition known as childhood apraxia of speech or CAS, which has made her journey through speech development quite unique. A little bit of background about SS. So she had a completely normal birth and medical history, and she also started speaking at around 12 months of age, just like most children. However, there was a peculiar twist in her development in which her first words disappeared for about 6 months. And it wasn't until she was around 36 months old that her speech began to progress and also started combining words. So the features for SS condition is that she had a limited range of consonant sounds, and she also often substitute them with glottal stops. So what is a glottal stops? So glottal stop is when you stop the air flow and suddenly you release it. For example, is the word oh, like when you stop the air, which is and then you sudden release it as oh. And another example is in other accents, such as when people say butter instead of butter, so that is also considered as a glottal stop too. However, in SS case, that is not her accent but due to her apraxia. There is one interesting fact about SS, which is that her language comprehension remained within normal limits, which is considered as unusual for the CAS patient. This is because usually CAS patients would not be able to articulate their thoughts clearly. In addition to that, SS also met 10 out of 11 criteria for CAS, which emphasize the complexity of her condition. So the criteria of CAS that SS have is that she had difficulties with specific consonants such as D, L, and R. Other than that, her speech often involved omitted consonants, vowel errors, substitution of words, and distortions. And in place of consonant, she would frequently use glottal stop, as I said before, which further complicates her speech. During her evaluation, the medical team had observed a variability in her speech, especially when she attempted to repeat short sentences. And the result of the observation showed that when she struggled to talk, she would slow down her speech. And when she felt uncertain about particular words, she would make minimal lip movements, which would impact her vowel sounds. Occasionally, she even nasalized her vowels in spontaneous speech. In terms of her speech patterns, SS typically used straightforward syllable structure and tended to avoid longer words and inflections. She also encountered difficulties with tasks that required rapid alternating speech movement. Interestingly, there were no indications of structural issues or sign of dysarthritic symptoms during oral motor tasks, except for some minor challenges related to lip protrusion and retraction. So from the case of SS had suggests that her primary struggles were related to planning and executing the movement necessary for speech.